many schools handle it differently. I think there should be more standardization. I think it also needs to happen much earlier now.
Okay.
I think when a child is in high school, we're so far past the point of no return. This needs to be something that's done at the elementary school level. That's how it's, in my estimation, I've been at this in some regard 23 years, if I look at the history of when I started studying. Every school has a certain amount of programs, but despite the resources, and there are enough resources, families have to do their own work because they struggle with saying that there's a problem here because everybody blames themselves, which is not the most effective technique, but that's what happens. They become very self-blaming. So when a child gets to high school nowadays, we're a little bit behind the 8 ball, no pun intended. So,
If I may?
please.
A couple of things I do want to reiterate or also bring up is we often get calls from parents. I suspect my child or my teen is using drugs and I want to get a drug test, which is of course an effective method to determine if in fact somebody is using drugs. My response to most inquiries like that, and one of the things that Jason or Dr. Ross and I have discussed, is if you're going to test your loved one for whether drugs are in their system, you better have a plan in place of what you're going to do in response to the result of that drug test. So oftentimes when we talk about preventative action or being a caretaker or that person getting help for themselves, they have to know and be knowledgeable of what they want to have happen. Because, okay, they're drinking, you can smell and detect alcohol easy enough. They're disoriented, oftentimes they're using over-the-counter medication. There was a big epidemic with triple Cs in the pharmacies where they had to put them behind the counter because the kids were taking them and overdosing on over-the-counter antihistamines. There's, of course, now Crocodile and Flocka that's out there, very, very, shall I say, cost-effective, disorienting and psychosis-inducing chemicals that people are having severe problems with. That are obviously somebody's on something. But if you want to know if somebody's using marijuana or cocaine or any other opiates, for instance, you better have a plan in place of what are you going to do when in fact they come up positive. Otherwise, don't test them. Because if you don't have a plan, it's all for naught. If you're not going to be able to set and maintain healthy boundaries for yourself as a loved one, as a parent, or as a spouse, you're setting yourself up for more heartache. So be very careful in what we ask for. The other thing, when you mentioned the school systems, there's a very fine line in a gray area of where the school is now parenting that child and stepping into how that family operates and where that boundary is. It's none of your business. What goes on in my house is what goes on in my house.
It's Vegas.
And so it's a very challenging kind of situation.